The Gauteng Health Department has suspended Tembisa Hospital CEO Dr. Lekopane Mogaladi. This is breaking news tonight after the death of Shonisani Lethole at the facility last year. The businessman died after going for several days without eating and receiving substandard care at the hospital. Health Ombudsman Dr. Masego Rahlaga found the hospital guilty of gross negligence at the release of a report earlier this week. eNCA's Masego Rahlaga has been tracking the story and joins us live with the latest on the breaking news. Masego, what more are we hearing from the Health Department about the suspension of the hospital CEO?
Well, Tembisa, you'll remember that the hospital CEO had done a few media interviews earlier in the week talking about how he would take Professor Masego Rahlaga's report on review. Of course, now we're finding out from the Gauteng Health Department that they served him with a notice of suspension yesterday, so precautionary suspension, and they've given him 5 working days to respond. So that means we start counting from Monday, so he'll have until next week Friday to respond to his suspension and, of course, the allegations that have been leveled against him. I think, Tembisa, the Health Department was basically forced to take this decision, or they felt they probably had no choice because of the stories, the horrific stories that have come out since the Health Ombudsman's report into the Tembisa Hospital and the circumstances surrounding the death of Shonisani Lethole. You might remember that earlier this week, I think a day after the Health Ombudsman released his report, more families started to come forward under the banner of Justice for Shonisani campaign. They had invited other families who came forward to tell horrific stories to me. I mean, I remember 2 specific ones. For instance, the one that actually resonated with what the Health Ombudsman found about files at the Tembisa Hospital not being kept orderly and being appalling, as the Health Ombudsman actually described in his report, was a woman who was pregnant with twins. She had an appointment for a cesarean section at the hospital, but when she arrived there, they lost her file. They simply told her that they've lost her file, so they are not sure if she's pregnant with twins. And as a result, she gave birth on the bench waiting and lost one of her babies. The other story that I remember quite clearly is of a 19-year-old student, UNISA student, who says that she's now an orphan thanks to Tembisa Hospital. She says her mother was admitted to the hospital around the same time as Shonisani last year in June, and they put her in a COVID-19 ward without having gotten any result that she's COVID positive. She also wasn't fed for about 4 days, but what's worse is how it was so similar to what we heard in the Life Esidimeni cases of the fact that her family couldn't get a hold of her mother from the 27th of June. So they decided to go to the hospital on the 3rd of July to find out where she is. And the hospital just told them, we apologize. We actually were supposed to let you know that your mother passed away on the 29th of June. So this is 4 days later without having told the family or this young girl that she no longer has a mother. So I think the Health Department was basically pressurized to actually take a faster decision, not just only that recommendation to put 19 staff members under a disciplinary hearing.
And Masego, in the case of Shonisani Lethole, which has now been concluded by the Health Ombudsman, Professor Masego Rahlaga, it's bad enough that about 19 staff members will now face disciplinary processes to do with the negligence. But there was also a finding that when the matter was brought to the attention of authorities, because Shonisani Lethole on his deathbed tweeted the health minister, it was found that staff at the hospital in fact lied during the course of the investigation.
Exactly, Tembisa. And I mean, I asked the Gauteng Portfolio Committee in Health spokesperson, or rather chairperson, earlier today, whether or not that constitutes enough grounds to actually start a criminal investigation. Tembisa, a lot of people agreeing. I mean, for instance, when you're talking about people withholding information from the public and from the family regarding whether or not Shonisani Lethole ate, that's what the Tembisa Hospital did during the investigation. During the time that they were interviewed or spoken to by the former health MEC, Dr. Masego, the hospital staff telling him that Shonisani Lethole was definitely fed. They were also saying that Shonisani Lethole was, obviously he was displaying the the hectic symptoms rather of COVID-19, but not being seen by a specialist doctor by only until the third day that he was there was also problematic. But talking about the withholding of information to Mbekile was also the shocking revelation that a doctor actually admitted to the health ombudsman during that investigation that he tried to falsify, or rather he falsified a form that a doctor is supposed to fill out to certify a person dead. This is supposed to happen within 2 hours after a person is deceased. That's the law. But the doctor arrived about 10 hours later, so already something was wrong there, and that's why there was that confusion on when exactly Shonisani Lethole passed away. But this doctor admitting to the National Health Ombudsman that he falsified that document to alter the date to which Shonisani passed away is also something that was very alarming.
eNCA reporter Masego Rahlaga with that breaking news tonight, the suspension of the hospital at the Tembisa Hospital, the suspension of the CEO, I should say, at the Tembisa Hospital following the release of that health ombudsman's report into the death of Shonisani Lethole at the facility.